And now it is time for everybody's favorite segment here on Hipp Nights, the Perfect Hipp Vet Check. That's right, we're doing it again. We do it every Tuesday here at Hipp Nights. I'm Joe Hipperson at iWatchRadio.com. Now you can see what I'm talking about, hence the vet. Look at that, the perfect vet. Dr. Laura Platts here at the Bear Station Veterinary Clinic, conveniently located in Manchester and Mason Lane, which is very important, even though I've been here a billion times. Do you realize I went down the wrong Mason? Would you believe that I pulled that off?
Today?
Yes, I did, on my way here.
Nice.
Well, and I'm glad I did it too, because I thought to myself, I don't say Mason Lane enough. So there you go, Manchester and Mason Lane. See?
All right.
You dig it?
I dig it.
Okay, so today we're going to do what exactly?
Okay, so we're going to talk about ear infections today, another very common thing that we deal with on a regular basis. I would say probably half of the dogs that we see are very prone to this problem because of their anatomy or other issues. But it's important to know that not just anatomy, so it's not just the floppy-eared dogs. All dogs can have this problem.
Now, is that a scientific term?
It is floppy-eared dog.
Floppy-eared dog.
Absolutely.
Okay. Hey, does it ever weird you out when people name their dogs and it makes it obvious what kind of dog it is? For example, these little painting photograph things, I don't know if that's a photograph or painting. Either way, this one up here, it says Stacy. Now, if I didn't see Stacy, I'd think, that looks like a guy dog. But then when the guy-looking dog has a girl name, it just freaks me out.
No, I don't know. I don't mind that so much, but there's a lot of the chocolate lab is the one that's classic. There's, I don't know how many, Cocoa, Nestle, you name it.
For real, Nestle.
Yes. Yeah, I mean chocolate, you know, all kinds of Hershey.
Well, chocolate's okay, but some people say it weird. You ever notice that? The word chocolate? I know this
haven't noticed that.
No, I know this is the perfect Hipp Vet Check. I get that, but there are people out there that'll say chocolate, and it just kills me. It really does. No, really.
Did I just do that?
No, you didn't. You did not.
Okay.
I just wanted to say to the people out there that have dogs named Chocolate, that is the name of your dog.
Okay.
Chocolate is not. So we're talking about ears, right? So I should just get right to it?
Yes.
All right, that looks... I'm not going to say that. That's just weird looking. What are we looking at? What is this?
That is a diagram of a dog's ear canal, and this is important because we are always taught don't put anything. You know, be very cautious about putting.
Are you doing a demonstration?
Sort of.
Okay. Are you going to put something in your ear?
I'm not going to put anything in my ear, no.
Okay. All right.
But don't put things in your ear because it's such a short distance to your eardrum. But that's not the case for dogs. So we've got this huge vertical canal, and then it makes a sharp 90-degree turn way in here to where the eardrum is.
Okay, so what you're saying is if a dog, right, were to be using a Q-tip, which a dog would never do,
right.
But if the Q-tip went into the ear, it wouldn't even hit the drum because it's got to take a drop.
It's possible with a Q-tip because it can turn and go down there, but moral of the story is it's very difficult to get to the eardrum. I don't advise people to use Q-tips at home. We use them here to collect a sample, but I don't even use them when I clean an ear. I use just cotton balls.
Okay. All these props are great. This is very cool. I
know. Yeah. So when they get an ear infection, sometimes you may not see evidence externally right away because again, this ear canal is so deep. And the most common ear infection is a yeast infection. Sometimes it's bacterial, but it's usually yeast. And again, that's because we've got this big, deep, cavernous type canal. So that you need to go see your vet for this, and we're going to do some cytology. I said I would take samples using a Q-tip. I do that, look at it under the microscope, find out what type of infection we're dealing with, prescribe topical drugs based on that, that you're going to put into the ear on a regular basis. Now, backing up,
are you going to back up?
I'm not. I can.
Okay, well, barely. I mean, it's fine.
But anyway, usually ear infections are not a primary problem. So yes, they get ear infections, but it's usually secondary to something else. That I mentioned earlier, allergies. That's the #1 reason. Sometimes thyroid problems or other endocrine disorders can be related.
Other what disorders?
Endocrine.
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 Okay.
Hormonal imbalances, things like that.
We might echo a word of the day.
There you go.
Endocrine.
Endocrine.
Well, I don't ever use that word.
Endocrine. Yes. Okay. So if it becomes a repeated issue that we're treating these multiple infections, we want to start trying to look at the underlying cause because we don't want them to keep having infections. Yes, we can treat it, but the more infections they have, they're going to develop scar tissue, and then they're not going to have a normally functioning ear canal, and then they're going to have ear infections the rest of their life because of that. So moral of the story, you want to find the underlying cause. Whether you do allergy testing, lab work, there's all sorts of things you need to do and work through with your vet, but that's all very important. And then the other thing that is important once you deal with the infection is routine care at home. And that would involve ear cleanings. And like I said, I use cotton balls You need an ear cleaner that's specifically designed for that purpose.
Okay.
I'm not a huge fan of the homemade stuff because it's hard to get the proportions right, and people sometimes use peroxide. Don't do that.
Okay, that's a no then, because I was going to actually go there and say I've heard, peroxide things and,
No, I don't like the peroxide. It is very similar to water chemically. We're talking one different oxygen molecule. I don't want moisture in there, so let's not go there. All these ear cleaners have a drying agent, and that's the reason that's important is because when we're talking about yeast, moisture is part of the problem. So we want something to get down in there and not only provide anti-inflammatory and cleansing effects, but to dry that ear canal so that we don't have excess moisture that's going to lead to the yeast infection.
Is it true that the ear infection of a dog could be one of the nastiest, grossest things of all time?
Yes, it can get pretty gross.
It can be pretty ripe.
Really, really bad.
No, I know. The bad smelling thing in the ear, I mean, there's nothing worse than, okay, true love between a dog owner and his pet, all right, is a guy or a girl that can just take a hit off that ear and figure out, oh my God. I mean, really, there's some serious stuff going on.
I would agree with that.
I've been in those situations. Yes. It is no good. If you don't mind, before we continue with the ear, what is that? What is this thing in here? I mean, we're in a different lab room every time we do the perfect hip vet check. What do you guys do with it? I mean, can I ask?
What, this? The table?
That's the table?
Yeah.
Stop. Seriously? Oh my God! Wow, this is really insane. No, I mean,
so it saves our backs. So you got these huge dogs that you need to bring up.
Oh yeah, okay.
You don't want to bring them onto the table.
That is okay. I swear, I don't script anything when I do my show. This is completely.
You know, we had a Six Flags ride here at Barrett Station.
What? I would have sat on it if I would have known that was going to happen. That is really cool.
Yeah,
see, I thought it would have been like a weight thing. Like it would have been like a scale. That is really, really awesome. So, wow, that is so. And you just did it just like that. That is so neat. All right, cool. Thank you. That to me, that is a pretty much. And what is this here? What is? Oh, wait a minute. Wait a minute. Hold on. Let's see. Oh, wait. I got it. Look at that. That's your degree, isn't it?
That's it.
Did you take us to this lab room for a reason?
Yes, I did.
Now that this perfect hip vet check is going on, people are really digging this segment. You just want to basically strut and say, oh,
that's right.
Yeah, check me out. That's a freeze frame moment. So, where do we round out on this ear situation?
Okay, one thing that I think people, where they make a mistake sometime is after they have had the dog into the vet, treated for the ear infection, and you've gone through the process, you think everything's fine, and you don't do that follow-up visit that your vet recommended. And if you don't do that, oftentimes, again, that ear canal is so deep, it looks great on the surface, but we've still got some activity going down that you're only going to see if you look in there with the otoscope, which is the tool we use to look into the ear.
The otoscope.
Otoscope.
Okay.
So it's
a cool word to say.
It is.
Otoscope. Try to say otoscope without smiling. Just try it. You can't do it. I smile right now. Otoscope. It just happens.
All right.
It's a happy word. If we can teach people happy techniques, we should. I mean, the ear thing is gross and just nasty. That's my medical opinion. But saying otoscope makes it all better.
Okay. I'll go with it.
Okay.
So anyway, make sure you get into that follow-up visit at the end of the treatment to make sure you truly did clear it up. And that also is important because not only do we want to make sure that we did a good job cleaning it up, but if these problems where they're recurring, it's important to determine, did it not go away fully? Or did it go away fully and come back? Because if that's the latter is our option, then we really need to be looking into those underlying causes that I mentioned earlier.
All right, excellent. Well, thank you very much for another wonderful edition of the Perfect Hip Vet Check, featuring the perfect Dr. Laura Pletz, courtesy of the Barrett Station Vet Clinic here in Hipp Nights with me, Joe Hipperson, where now you can see what I'm talking about.